Let's pretend I've got, one in my. Here we are. Okay.
There you go.
What are you telling me on my first visit to the dentist with my child?
So on the first visit, we'll do what's called a knee-to-knee exam.
Yeah.
So you'll lay your child in my lap. We'll look at the teeth. So we look at the teeth, what teeth are in. Are you kind of at age-appropriate milestones for getting teeth? We talk about toothbrushing because we like to promote brushing with a smear size of fluoride toothpaste as soon as the first tooth comes in. So we talk about nighttime routines. Diet is a big one. Bottle usage is a big one. So it's mainly for the parent to kind of feel comfortable and go over their, routine and educate them.
Yeah. In the UK, we've got like a couple of different formulations for toothpaste. Is it the same in the US? Obviously, the adults is over 1450 ppm for fluorides. What are you kind of advising for the kids? Or some dentists over here will say just use a small amount of the adult toothpaste. Some of them saying get one with a 900 and just give a pea-sized amount or a smear. Are you saying similar things?
As far as I know, I'm not sure actually if there's a difference in children's and adults. We typically just recommend using the smear size, whether it's children's or adults. Usually we say children's for it just because of the flavor.
Right.
And not to use training toothpaste once the first tooth has eroded, because in here the training toothpaste has no, fluoride in it. So if the child were to get some and eat the whole thing, there wouldn't be a concern of toxicity, but here we just have a very small
low dose
size.
one, yeah.
That's a good question.
Thanks. And then in terms of bottles, are we talking free flow and metered? Or was it not metered? The one where you have to suck it. I'm not sure what you would call that. Free flow is where it pours, isn't it? And then the other one, the baby has to suck.
I know what you're talking about. I'm not sure the official name.
Yeah. Is that similar things that you would kind of warn them about before they get on to kind of giving them juices and hopefully not juices, but, milk in a cup and stuff like that?
Yes. So our main concern with the bottle is a child being put to bed with a bottle filled with milk, or, I've had people put chocolate milk in the bottle, juice in the bottle, because then sugar sits on the teeth and that'll cause the decay, the baby bottle tooth decay. So that's where, talking about nighttime routines and seeing what parents are already doing is really important. After age 1 to 2, we start talking about using the different kinds of cups and things like that.
Yeah.
But for the bottles, we really try to get them to not send them to bed with a bottle, or if they need to, if they absolutely feel like they need to, a bottle of water or something like that.
Yeah. I tend to say maybe some water or some, plain milk. And that's pretty in the grand scheme, pretty harmless. So you've done that kind of early prevention side of things. When they then come in, they're starting to get, do you call them D's and E's in the US? So primary, secondary molars. So the primary molars coming through. At that stage, what you kind of starting to tell the parents and what the things you're looking for?
So when they're starting to get all of their primary teeth, we're looking for, are they getting crowded? Or is there spacing in between the teeth? And more about, foods, what kind of foods are they eating? What kind of foods are they trying? Things like that, kind of getting more into their diet. Because a lot of kids, that I see eat the fruit snacks, eat things that are high in sugar. So just kind of getting on that, talking about those refining surfaces of the teeth with deep grooves that are susceptible to cavities, unfortunately. So it's really diet and education for a lot of patients.
So that's quite similar. We have diet history sheets they have to do. In one place I've worked, it was 7 days. Another, it was 3 consecutive days, but one of them had to be a weekend day to kind of get that range of what's happening at school, what's happening at home. Are those things that you're also doing as well, just to kind of get parents to think about what we're eating and when we're eating it?
So I wish we had a paper form. That sounds like a really good idea. I usually just ask, what does lunch look like for you guys? What does a school day look like? What does your dinners look like? Trying to get the information that's on that form, but parents will tell me what they eat at grandma's house is a lot different than what they eat at my house or what they eat at school. So it's just trying to get as much information as you can. But those forms sound really nice.
Yeah, I'll send one across to you once I start back up at work. I've got a couple of weeks off, but remind me and I'll get that sent across. And anyone else who wants that, then yeah, just send me a message and I'll get something sorted. Um, the